Good day, I'm Julio Atencio from Colombia, Medellin, and in this video I want to show a cataract surgery with Ultrachopper tip. First, we perform the paracentesis with a 15 grade blade. Notice that in the perform the paracentesis I only insert the tip and enlarge the incision with a side movement. Then I put topical anesthesia is lidocaine with epinephrine, preservative free at 2%. I put like 0.5 cc's. That's maintained the dilatation and give me a good pain reliever. Then I put some trypan blue to stain the anterior capsule and give more rigid to the capsule to perform a better capsulorhexis. Then I put some dispersive viscolaxatives to give a good tone to the eye to perform the meninization. I use a 2.8 millimeter knife. First I grab the eye and then in one plane I perform the incision and I give a little pinch to the anterior capsule to open it, and then without trata forceps I open the flap and perform a continuous circular rhexis. Always grab short the flap and pull to the center in a circle movement, and in that way you can achieve a continuous circular rhexis as we notice here. Then I take out a little bit of the visco to relieve the pressure of the eye to perform the hydrodissection with a standard cannula. I performed in both sides, right and left, and always pull down the nucleus to relieve the saline that is behind the nucleus. Then with a chopper I rotate the nucleus, and here you can see the Ultrachopper tip. I accommodate the sleeve to the Ultrachopper, put the side ports by the side to have a good foldability. Then with the nucleus sustainer of a scaff I go to the equator of the cataract, grab it and lift it up a little bit, and then just with a mechanical movement I chop the cataract in 4 pieces without ultrasound, only with mechanical movement. It's like a divide and conquer but with a knife. Here you can see I perform 4 chops, but you can have like 4 or 5 quadrants. The small pieces is easy to phacoemulsificate. Then when you finish all your chops, you change the tip for a Kelman tip that takes about 1 minute. You check that the side port of the sleeve are by the side. You don't want to the irrigation go to the endothelium, and by the side, by the port, you will have a good foldability, so the fragment comes to the tip and you don't need to hunt a fragment because the phaco-dynamics brings the fragments to the tip. And as a nuclear manipulator I still use the sustainer just to keep the control of the fragments and help the tip to emulsificate the fragments. You can see how I continue move the fragments with the left hand and try to left the right hand really steady in the center of the eye, and all the movement you see you do it with the sustainer. In this part I pass to epinucleus. I always do epinucleus in the last fragment to avoid subit a subit collapse on the anterior chamber. So you want in this step to rupture the posterior capsule. Then with the Burato cannulas, I perform the aspiration of the cortex. Here you can see that I go to the equator, take the fragment, and do lateral movements, and then pull to the paracentesis. And when we are in the paracentesis, that's where you do full aspiration of the fragments. Not in the capsular bag, only in the paracentesis. Yeah. You go, take it, lateral movements to take it out, and pull back through the paracentesis, and then full aspiration. That's a safe way to do cortex aspiration. With now with the irrigation buratos, we insert the intraocular lens in the eye without viscoelastic. You only need to keep the eye soft, to keep the saline inside the eye, and then you insert the lens, and with the same burato you reaccommodate the position of the lens and finish cleaning the rest of the minimum visco that you have in the anterior chamber, so you don't have any problem in the post-op. And finally we put some air inside to keep the wounds closed and hermetic. And I don't like to irritate, I like to close it with a cotton, just dry it and close it, and that's the way